2, 3, 4. Do you need to bend that right leg or is it okay? 5.
Fine.
Think about it, like your legs, let's pretend like it was the right leg. Well, when you're tucking your head like that, you're putting full tension, almost full tension. Like if your foot was up, it'd be full tension on that right leg. So you had it like partially full tension. 1, 2, 3, go slow. 4. When I say, lots of times when I tell patients to engage their core, they just suck in their stomach. So we're gonna go over an activity to help to just make sure that you're engaging your core. So I'm gonna have you lay on your back. I want the side view. Your knees bent. I don't have a video. Oh, actually, I do have a video for this one too. But so you're gonna make your back flat against the mat. Good. And then with your hands, you're gonna feel like, I guess, so with you, I can say PSIS or ASIS, and you'll know what I'm talking about, right? So the bony prominences right by, like right here, okay? And then I want you to go in with your fingers. So it's almost like there's a bony, like your bony prominence here, and then go in, okay? And then I want you to cough. Good. So did you feel the muscles contract under your fingers when you coughed?
Yeah.
Yes?
Yes.
Okay. So when I say contract your core, I want you to engage those muscles. So you're gonna keep your fingers there. Okay. When I say engage your core, I'm gonna set a timer for 1 minute, and I want you to practice keeping your core on and breathing. Don't hold your breath, okay? So next, what we're gonna do is you're going to engage your core, and then you're going to do like little marches, but not big marches. So you're gonna lift up one leg just slightly off the mat, and then go back down, and then the opposite leg, like you're marching, but you're gonna try to keep your core on while you're moving now. So it's gonna be a little bit harder, and I'll set the timer for 1 minute again.
Okay, and while I'm lying down?
While you're lying down. So make your back flat against the mat. Okay. Turn your core on, and then lift up one leg just slightly off, and then lower it, and then the other leg. And try not to rock your pelvis too much. You're trying to keep your pelvis stable and breathe. Okay. This time, when you engage your core, instead of marching, you're gonna let one knee fall out. Like let's say you're gonna move your left knee and it's gonna fall out towards me.
Okay.
So just go ahead and do the movement without your core right now. You're only gonna let it come out so much to where your pelvis doesn't rock. So you're not gonna go all the way down. You wanna try to keep your pelvis stable and then go back in. And then do the other leg. Only so far that your pelvis stays stable. Okay? So let me get my timer. Make your back flat. Engage your core. Breathe. And do the movement.
Use the leg muscles.
Well, you are using your leg muscles because you're also keeping your core on at the same time.
Okay.
So as long as you're engaging your core and your core muscles are on, you can use your leg muscles to control your leg movement and make sure that your core being on is going to make sure your pelvis stays stable, but you're going to have to use your leg muscles to make sure you don't go out too far. Remember to make your back flat first.
There's no tension, and then there's tension here. So is that a good?
Yeah, that's good. That's good.
I feel the tension.
And you may even, when you do your first rep, if it's too tight, you can loosen it, like if it's too much resistance, but So make your back flat before you do anything.
Mm-hmm.
And then engage your core. Now lift, and you may want to move your feet out just a little bit more. There, perfect. Okay, so back flat, engage your core, lift your bottom up off the mat, not your feet. Feet down, your butt comes up. Hold it, 1, 2, 3. Now bring your knees apart to get the resistance from the band. 1, 2, 3. Bring your knees back together and lower down slowly. 1, 2, 3, 4. Good. That's a good 4 count going down. Were you able, and just do the best you can with trying to keep your core on the whole time and breathing, right? All these things to do. So that was 1. 1, 2, 3, open. 1, 2, 3, close, and lower on a 4 count. 1, 2, 3, 4. When you're coming up, you're rotating. Don't rotate.
Okay.
So you're rotating. Yeah, you just want to go straight up. So try to keep as much. There you go. That's better.
Okay.
So then you would.
A little more difficult.
Hmm?
That's a little more difficult when you don't rotate.
Yeah, so you want to try to stay, you want to try 10 without the band, and then we'll add the band if you want to after that.
Okay.
So let's go up and hold it. 1, 2, 3, and down and open. Yep. And then close. And if that's too easy, then you would straighten your legs, do a full side plank. And then if that's still too easy, then you would don't rotate. I see you rotating forward a little bit. Do you see yourself? Can you look at, there you go. You fixed it on your way down. Look in the video too, so you can see her. There you go. That's it. 1, 2, 3, and down, down, and up, open. 1, 2, 3, close, and down, and up, open. 1, 2, 3, close, and down. 1, 2, 3, 4, 5, and switch. 1, 2,